My practice of Pete Bond Interventional Pain Care, I've been practicing in this entity now for 7 years. I've been in Salisbury a total of 12 years in practice, originally performing both anesthesiology and pain management duties, and the last 6 years is pain management. What we did recently in the last year and a half, we expanded into the Lake Norman market. We're trying to capture a larger patient base for procedures that not everybody performs. We have an approach to pain management that for both Chris and I, we feel the same way. If you can find a procedure that is better for a patient, that gives them better outcomes, where they're not so dependent on taking a pain medication, that's what they should have done. It's my philosophy that narcotic medications and other adjunct medications that we add for patients that are non-narcotics are all good for them, but if we can find a procedure to keep them from starting it or to make them less dependent on that type medication, they're better off. Their bodies don't have to metabolize all those medications. They feel better, they have less side effects, etc. So again, by doing what we do here every day, looking for procedures that both Chris and I can do to improve function, our patients are better served, and we're just trying to expand that into the Lake Norman market. And that clinic in particular is starting to get very busy from the standpoint of patients hearing about us and friends referring friends, etc. So we're very happy about that. We have been very busy in this office, and with the addition of the mild procedure, I'm getting calls from patients in South Carolina and Virginia who have heard about it through, again, friends that generally live close to here, who are wanting to be seen regarding this and see if we can help them as well. So hopefully the word will get out for myself as well as other pain management physicians like myself who can offer this, because I think the day that we tell a patient that we just have nothing more to offer, that you just have to live with the pain. We get that a lot from surgeons who tell them that, and other doctors, maybe their primary care doctor, and maybe they don't know about all we have to offer. But every time we can help a patient like that who comes to me and has that idea in mind, and then we find a procedure too, maybe a lesser procedure than the mild, or maybe we work up the ladder to doing procedures like this, or spinal cord stimulation therapy, or intrathecal or spinal morphine therapy, whatever it takes. We improve a lot of lives on a daily basis, and that's always been our philosophy. One of the things I find in chronic pain management is that our patients, I talk to our staff about this, but what I find is that once we get a patient in our practice, unless they volunteer to leave or unless they've broken some of our rules that we have about medication therapies, etc., we tend to keep our patients. They tend to keep wanting to come back. And I feel the reason for that is that both Chris, my physician's assistant, and I, as well as the whole staff, we listen to what they have to say. There's too often in this country, I feel right now, when it comes to interventional pain management or just pain management as a specialty, too many different specialties are involved in it. I don't think people are well trained enough to do all the things that are being done. And one of what we hear a lot of from patients who come to this practice is that the doctor rushed in, he put a needle in my back, he rushed out, I didn't know what he did, he was gone before I had a chance to talk to him, etc. And we just don't practice that way. One of the things that Chris and I try to take our time with every patient, listen to what they say. And I was taught a long time in medical school that if you listen to what a patient tells you about where they hurt and what's bothering them, you really don't need as many studies and blood tests to figure out what's going on with them. About 99% of the time, you can understand what needs to be done by just listening to what the patient's complaint is. And I think that's what we do a lot of. We listen to the patients, we try to isolate where their pain is on physical exam, as well as speaking with them and understanding where the pain's coming from. So I think in this busy world of medicine where everybody's rushed to see as many patients as they can because of decreasing revenues, doctors have to see patients a larger volume every day. We try not to do that. We try to list each patient. So I think that's what keeps our patients coming back. We have a great staff here. We have people that have been with me from the start, and again, because of that, patients hear about us. Word of mouth gets out about the way we treat our patients, and that just keeps more patients coming in.